I will be teaching you guys how to do basic suturing techniques, and I am not a professional, disclaimer. I'm learning and I'm teaching you guys. These are just the instruments I will be using, or the materials. That's a suturing pad. There's a regular scissors just to cut the thread. There's the next scissors, which is actually the needle holder, then a tweezer, and then we have the needles. They have some very funny names. Nylon something something, can't make that out right now. There's a chromic cat gut brown and silk braided black. There are some really funny names, but those are the needles that we are using. If you don't have a suturing pad, you can also use a banana, preferably one that is not too ripe. Use a knife to draw a line through the banana skin. Don't penetrate the actual banana. I was having some issues trying to hold the needle, and this is not shown, but to hold the needle holder, put one of your fingers, one of your thumb finger to one of the holes, and your ring finger to the next hole, and the rest of your index finger on the needle holder, something like what I have right here. You're going to enter the skin, which is represented by the suturing pad at a 90-degree and angle. Oh my. And then you're going to turn your wrist so you can bring the needle through, just like how the needle is coming out right through there. So you have to turn your wrist after you enter at a 90-degree angle. We call that pronation. And then once you get the needle through, we'll try and get it through first. Some persons to get it through like this and then penetrate the next side, and some persons bring it directly to the next side without bringing back the needle out. But we're going to bring the needle out instead of going straight to the next side. It's a little bit easier this way. It's having some issues still, but yeah, the whole point is to get the needle out from that side. So the needle is out, but we need to bring it through to the next side. Just like how we had entered from that end, we need to penetrate the next side and bring the needle through. You see what I mean? But some persons don't bring the needle out, they just directly penetrate the other side. So we're going to open the skin again with the tweezer, enter the skin at a 90 degrees angle, which I hope that is what I'm entering at. You turn your wrist to bring it through to the next side. And beautiful. And just pull through and leave a little bit of thread on the other side, not too much. I have three sutures above. That is the one that we're doing now. Those three right there. That is the same simple interrupted suture. What we want to do now, we're going to rope the thread, the needle end part around the needle holder two times. Make two loops, and you're going to turn away from you, and then you hold the tweezer, the other end of the tweezer, and then you pull the end that has the needle for it to come through like this. And we're going to do it two more times, but this time we're going to loop only one. This time, instead of looping away from you, you're going to make the loop around the needle holder one time towards you like that. And then you're going to get the next end with the tweezer and put it into the needle holder. And then you're going to pull the end that has the needle. That is the end of the needle. You just can't see the needle because the thread is a bit long. Just pull it and it will come through. Pull it towards you. And we're going to do it one more time. We're going to loop one time around the needle holder, but this time instead of toward you, you're going to loop it away from you. And then you're having some issues right there. But it's a learning process and we're learning together. Loop it once and then take the next end, bring it into the needle holder and pull the end that has the needle towards you. It should go through. And that is it. I hope you guys are finding this helpful, and we have some more sutures to look at in another video. We're just going to trim it. We're going to trim the other end. It's a simple interrupted suture, so you just have to continue it all the way down until the wound is closed. You can't see it so well, but the suturing pad has a line going down, a split line. So that is what we are trying to close. There's like a cut. So the line that you see that we have sutured, it's an opening. So we're just trying to close the opening. And look at that, it's beautiful, it's simple, and you can watch the video again to get a better understanding of it. I don't know what she's doing right now. Anyways, thank you for watching. See you in our next video. And if you have found this helpful, please do like, subscribe, share it to someone, a medical or nursing student, or anyone who's interested in learning some simple, basic clinical skills. So, thanks again for watching and see you in our next video.